In this week's muscle breakdown, we're going to be covering the levator scapulae muscle. Very important in neck pain, neck dysfunction, and a lot of unresolved neck and shoulder pain issues. What's up, everybody? I'm Dr. Matt Maggio, creator of the Peak Method and founder of the Soft Tissue Revolution, where we show massage therapists how to easily double their income, all while working 50% less and being taken seriously as a healthcare provider. So back at it for my muscle breakdown. This week, I want to talk about the levator scap. It's a very important muscle. It's actually vastly misunderstood in treatment models and things like that. Where it lives is basically back through here and then inserts right back up here on the superior angle of the shoulder. Now, levator scap is a wreck in a majority of people out there, especially in modern society. We spend way too much time looking down at devices, sitting, not moving how we should, and this muscle really gets beat to hell. Now, the main job of the levator scap, is they named it perfectly, is to elevate the scapula. That's what it's really designed to do. But what happens over time is it gets really beat up and becomes a secondary stabilizer of the neck. And what happens is it really tightens up to protect that area. So it gets really loaded up with a lot of scar tissue. When people have scar tissue in that muscle, it just leads to weakness, decreased flexibility, and a lot of pain. So what happens over time is, with our postures and just being sedentary, we put a lot of wear and tear on the joints, the nerves, the discs, and the neck. And all those muscles around there, they can't do their job either, and they can't stabilize the neck. So inherently what happens is we kind of go forward like that to kind of hang out, but we can't sit there like that, so we have to kind of pull back. So what happens is that levator is always on. It's in constant tension and constant pressure. Think if you walked around and like flexed your bicep all day long, it would be really sore, it'd be weak, it would be overused. This is what's happening in these muscles as well. So a lot of your clients come in and they complain, they're like, I just got this knot up here, I got this tension. That's what's happening, is that muscle is getting really beat up. Now what happens is when a lot of people treat it, they don't actually treat it effectively, because in a lot of the anatomy books, the way they lined it up, they kind of have it going in like a J motion. That's not actually right. It actually goes straight in and then back down posterior. And a lot of people have trouble finding it and properly assessing it and not getting enough tension. I talk about this all the time. In order to break scar tissue down and have an effective treatment that works, you must get proper depth, then tension to get in there and break it down. But these muscles are usually a wreck on people left and right. And if you're getting these clients that come in and you're treating them, getting in there and doing some deep work on that, but it seems to come back, a lot of times you're not effectively getting that tension on there. So what I want to do this week, a little different than normal, usually I just kind of give a palpation video of how to find it. I'm actually going to show how I treat it as well, because these muscles are so important and they can cause a lot of issues in overall neck stability, can cause compression and everything like that. And if you can get in there and break this down, it's going to make a big difference in neck cases actually lasting, getting better results, and getting out of pain. So check that video out. Now we're going to get some treatment on the levator scap, and this is where part of that warm up and that routine will help, really helping you approach that area as we put things together, with coming up on your toes, dropping down, getting the proper depth and tension, because this is a very dysfunctional area in the body. If you can treat it effectively, it's going to make a big difference in your overall cervical function. So same thing, I like treating any of this cervical area that we can in the chair. It allows things to be a lot more relaxed. Big step, always bring that arm over, lets things relax. That's going to open it up. Going to help the client through the motion. This one we want to get a little more extension than we even did down low. That's going to really help this slacken and open up. And then essentially the client is just going to go straight back down into flexion. That's going to be the motion. You want to make sure they have that down in the motion, because if they go too quick or they don't move it effectively, you're not going to be able to get proper depth and tension on there. So we've gone through the palpation of that, but let's just have a review here. So we find that superior angle and we find that C7. And a trick that I like to do is, as I bring it back, you'll see this crease of the neck. As you open that up, that's where it's going to start. So now I'm going to be able to actually go in there in the crease of the neck. It's like a cheat. And then basically our tension is going to go right down here, and where it gets dysfunctional is right in through here. So now that we found that area, we're going to be here. So now that we found that area, as we talk about in the warm-up, it kind of goes all together. You want to be at this 45-degree angle. When we're doing the CT erectors, you've been more here. This one, we're gonna come straight in just like this at a 45-degree angle. We found it with that extension. That allows us to go right here. We're gonna approach just like this, and then we're gonna back that thumb up just like we've been doing all along with that thumb backed up. And as we practice, our elbows are here, and remember we go up on our toes, and that's what allows us to get our depth. I'll get a little extra push with this other arm in there like that. I'm gonna back out a little bit, and then my tension is going to be a pull back with my lats, and my butt is going to drop, just like we practice every day. Once that's loaded, the client goes through that motion, and I'm not sliding, I'm letting it come to me. And you gotta be careful here to not be too compressive, because it really is superficial, and if you're too compressive, it's gonna trap. So continue to have the good mechanics like we talk about every day to set them up. They all come together. So in here, and your setup is key each time, because if you don't set up properly, you're not gonna get an effective treatment. So this is where you have to go slow in order to go fast. So we're in just like that at that 45-degree angle. We're gonna come straight up. We're gonna slowly drop in, get a little more depth here. We're gonna back out, and then we're gonna set our tension by dropping our butt and pulling our lats. And as that goes through, go ahead. Go nice and slow, and this is gonna be bad on anybody that has a neck problem. So the key is always in that setup. As we talk about when you're doing those warm-ups, you want to make sure if you're treating in the cervical thoracic area and you're treating down here, you're going to be here. But with this levator, it's kind of got a little bit of a laterality component to it. So your setup is key. So you set everything up just like that. The client knows exactly how to run through that motion. You're going to bring that extension back, and you're going to see I approach it at that 45-degree angle, just like we do in the warm-up. And essentially what I'm going to be able to do is I'm nice and relaxed here. I'm not compressive yet. I'm just letting things be nice and relaxed. I'm gonna go up on those toes, and then I'm gonna drop straight down. That's gonna help me get some of that depth. I'm gonna take this opposite hand that's backing it up, push in a little bit more. I'm gonna back out just a bit, and then I'm gonna drop with my butt and my body and pull with my lats, and the client's gonna go through that motion nice and slow. And let it come to you. There's no slide in this one. So hope you enjoyed that video. A lot of things that you're going to see here, and what I teach in my method called the peak method, is everything is very focused and process driven. We're never in a hurry. I always say you got to go slow to go fast. So a lot of people want to jump into treatment right away, and they're not able to do that. So if you're trying to treat these levator muscles with the client on their back or face down, you're not getting there. The key to treat it is actually having them sit up so you can generate more tension and more proper depth in there and break that tissue down, because these muscles just get so overused and they get so beat up. And if you don't get in there and clean them up, it's going to put more pressure in there. So think of like the discs and the joints in the neck as like your thumb, and it's stuck inside a car door. The car door is all that surrounding scar tissue and bad tissue. You can't give the disc and the joints a chance to heal up until you remove that scar tissue. So that's what happens in these muscles. And this is why we treat the levator scap first when we're actually getting in there and treating the neck, because it just decompresses everything. And when people hear decompress, they think like stretching or things that the chiropractors do, where they put you on some machine. No, what it does is it breaks that scar tissue down, and then everything can kind of drop, because a lot of people are walking around like this. When you can do that, it drops, and then it allows you to go in and treat the rest of those structures. But we always start in the peak method by decompressing these levators, because it just allows everything else to relax, because there's a lot of protective tension going on in there. So hope you guys enjoyed the video. I really enjoy making these. These are some of our most popular videos. If you want to learn more about the peak method, or you're interested in becoming a peak method trained provider, all the information is in all our profiles wherever you're watching it: YouTube, LinkedIn, Facebook. We're everywhere. We offer some free training to kind of get an idea of what's going on. But people are from all over the world are training in the peak method. They're doing really well. They're getting in there and becoming a solutions provider. They're helping people and being taken seriously as a healthcare provider. And even better is they're doubling their income all while working less. That is not a shameless plug. That is actually the truth. So I hope you guys enjoyed this video. If you like it, give it a comment, a like, a share, send me a message, any muscles you want to cover, and I will see you guys on the next one. Bye.